Welcome to this presentation. Myself Pratiksha Akki, Department of Pharmaceutics, Kelly College of Pharmacy, Hubli. In this session, I am going to discuss pharmaceutical excipients for parenterals. Contents of the presentation include introduction, properties, functions, vehicles and additives used in the preparation of parenteral products and conclusion. Parenterals are the sterile preparations intended to be administered directly into the systemic circulation. They are required to meet pharmaceutical quality standards as described in pharmacopoeias and to be safe for the intended purpose of use. Different dosage forms include solution, suspension, emulsion, powders, gels and implants. Parenteral preparations are intended to be administered through the human or animal body either by direct injections, which includes IV bolus, intramuscular, subcutaneous, or by infusion with a controlled infusion rate, or either by direct implantation through the intramuscular or a subcutaneous route. They must meet the following criteria. It should be sterile and pyrogen free. It should be clear or practically exempt of visible particles and to be free from subvisible particles that are required by pharmacopoeias. There should be no evidence of phase separation for emulsion or aggregate formation in case of aqueous dispersion. In case of suspensions, use of an appropriate particle size and any sediment should be readily dispersed upon shaking to give a stable formulation and ensure a correct dose to be withdrawn and injected. Parenteral preparation may require the use of excipients that should be biocompatible, be selected for appropriate use and to be included at the minimum effective concentration. Functions include to make the preparation isotonic with the blood by adding glucose, dextrose, mannitol and so on, to adjust the pH to the physiological one by adding mineral organic acids or a salt, to prevent degradation of drug substances, to ensure drug substances solubility and to provide an adequate antimicrobial preservative property for a multi-dose preparations. The main challenge of all the different parenteral dosage form is to achieve a good compatibility of the drug substances with the excipient as well as with the primary container. That is, there should be no formation of new impurities either by degradation of the drug substances or by formation of a new chemical entity between the drug substances and the excipient. Solubility with regards to the solution and emulsion, drug substances should be soluble and remain soluble during the entire shelf life of the drug product. If not soluble, then the dissolution can be achieved by the use of co-solvents, use of surfactants and a solubility enhancer. pH is also one of the critical aspects of preparation. It should be close to the physiological one. In case of a large volume parenteral, more than 100 ml should not contain a pH buffer as the blood has already a buffer effect property that could enter into the competition with the injected drug product. The stability of the drug product is another critical point that the formulator can face during the development of the formulation. Unstable drug substances leads to the formation of new impurities which hampers the safety and efficacy of the product. Apart from these, process of sterilization should be selected according to the characteristics of the parenteral preparation. Example, aqueous preparation, moisture sterilization is most preferred. For a non-aqueous preparation, dry sterilization is most preferred. Moving on to the different vehicles used in the preparation of parenteral products, it mainly acts as a medium during the formulation of parenteral products. It may be either aqueous or a non-aqueous. Water is used as a vehicle for most injections because aqueous preparations are well tolerated by the body and are safest and easiest to administer. Non-aqueous vehicles are used when the medicament is insoluble or slightly soluble in water, like dimercaprol. When the depot effect is desired, they are required in depot form to continuously replace the deficient secretions like estradiol benzoate, deoxycortisone. An oily medium is most preferred for a diagnostic procedures. Like example, oily suspensions are preferred for used as a contrast medium for X-ray examination of a respiratory tract because it is less irritating. Moving on to the different types of vehicles, first type of a vehicle is a aqueous vehicle. Let us see different examples of aqueous vehicles used in the preparation of parenteral product. First example is a water for injection. It is free from volatile and non-volatile impurities as well as pyrogen. It is produced by distillation or reverse osmosis and is used within 24 hours. Injection of a distilled water causes a rise in body temperature and it is said to be pyrogenic. At the beginning of the century, fever was a frequent complication of intravenous injection which was caused due to the microbial contamination of the water. The name Seibert in 1923 identified this and said that it was produced by a gram-negative bacteria. Second example for aqueous vehicle is a water for injection free from carbon dioxide. It is a sterile water for injection which is free from carbon dioxide. It is done by boiling water for injection for at least 10 minutes and should be preferred before administration. If water for injection used as a solvent containing a dissolved carbon dioxide which results in a slight acidity which is sufficient to decompose a salt and precipitate a free compound. So you can see the example amylobarbital sodium. If it contains dissolved carbon dioxide, it leads to the precipitated form of amylobarbital. Third example is water for injection free from dissolved air. It is a sterile water for injection which is free from a dissolved air. It is preferred by boiling freshly prepared distilled water for 10 minutes and should be used immediately. The most sensitive medicaments can be protected from oxidation, example adrenaline, betamethasone, chlorpheniramine. Next example is a bacteriostatic water for injection. It is a sterile non-pyrogenic preparation which contains 0.9% of benzyl alcohol as a bacteriostatic preservative. It is mainly supplied in a multi-dose container which is having a pH 5.7 and it should be chemically compatible with the container. Moving on to the non-aqueous type of vehicles used in the preparation of parenteral product, let us see some of the examples of a non-aqueous vehicle. First one is a fixed oil. These are the vegetable origin oils in liquid form which is having rancid resistance, unsaturated and a free fatty acid contents. Fixed oils for injections must not contain mineral oils or a solid paraffin because it causes tissue reaction and tumors. Examples for fixed oils include peanut oil, corn oil, cottonseed oil, sesame oil, soybean oil and so on. Next example for a non-aqueous vehicle is alcohols. It is chosen as an injection solvent only when other methods are impracticable. Example digoxin ergotamine injection which contains a low concentration to facilitate the solution of active ingredient. Next example is a propylene glycol. It is widely used as a vehicle for water insoluble drug. Example is a phenobarbital injection which is in solution in 90% which is stable to be sterilized at 98 to 100 degree Celsius. It should be given subcutaneously or intramuscular route unless an anesthetic benzyl alcohol is used. Examples include diazepam, lorazepam, phenobarbital, phenytoin and nitroglycerin injections. Moving on to the next part, that is different additives or excipients used in the preparation of parenteral products. To provide efficacious and a safe parenteral dosage form, added substances must be frequently incorporated into the formula to maintain a pharmaceutical stability, control product attributes, ensure sterility or aid in parenteral administration. So we should choose added substances that are accepted by the regulatory agencies throughout the world because of the extensive pharmacological and toxicological data required to obtain approval for any drug or new additives. Different additives include antioxidants, buffers, bulking agents, antimicrobials, chelating agents, inert gases, protectants and solubilizing agents. Let us see different types of additives used in the preparation of parenteral products. First example is the antioxidants. Antioxidants are used to inhibit oxidative degradation of therapeutic agent. It is used to prevent the formation of free radical by blocking a oxidative chain reaction. Example, ascorbic acid esters, butyl hydroxytoluene and tocopherols. They also act as a strong reducing agents and oxidize in preference to the therapeutic agent. Example, ascorbic acid, sodium bisulfite. These antioxidants maintain the product stability by being oxidized and gradually consumed over the shelf life of the product. Other examples include urea, salts of sulfur oxides and so on. Second examples of additives used in the preparation of parenteral products are antimicrobial agents. These are added in a multi-dose containers to inhibit the growth of microorganism accidentally during the withdrawal of individual doses. Only the limited concentration of agents are to be used and the formulation scientist must be aware of interactions between the preservative and other components of the formulation that comprises the efficacy of the preservative. Example is a protein that can bind to thiomarsal, reducing the preservative efficacy. Partitioning of the preservative into the micellar phase or oil phase can reduce the effective concentration of the preservative available for bactericidal or a bacteriostatic action. PET should be done on the formulation to assure an effective preservative concentration. Incompatibility of the preservative with the rubber closures or other packaging components, particularly the polymeric materials. Preservation of zinc insulin with a phenol causes a physical instability of the suspension, whereas methyl paraben is stable. Therefore, challenging the product with a selected microorganism to measure bacteriostatic and bactericidal activity, including evaluation of efficacy as a function of time throughout the shelf life of the product. Examples include benzyl alcohol, chlorobutanol, metacresol, phenyl mercuric nitrate and so on. Next important additive used in the preparation of parenteral products are buffers. These are added to maintain the pH of the formulation, to stabilize the solution from a chemical degradation. Drugs require certain pH range to maintain the drug stability. Therefore, drug solubility is strongly dependent. And there are some factors that influence the pH such as product degradation, containers, stopper effect, diffusion of gases through closures and effect of gases in the product. Buffers for parenterals are either weak base, salt of weak base or a weak acid, salt of a weak acid, and some examples include acetic acid, adipic acid, benzoic acid, citric acid, lactic acid and so on. Moving on to the next additive used in the preparation of parenteral products are chelating agent. They are used to remove the trace elements that catalyzes the oxidative degradation. They are added to complex and inactivate metals such as copper, iron and zinc that catalyze the oxidative degradation of a drug substances. There are different sources of metal contamination which includes raw material impurities, solvents, rubber stoppers, containers, equipments employed in the manufacturing process. Some examples include idadate disodium, idadate calcium disodium, idadate tetrasodium, citric acid and tartaric acid. Next important ingredient or excipient used in the preparation of parenteral products are inert gases. It enhances the product integrity of the oxygen sensitive medicament by displacing the air in the solution with nitrogen or argon. It is made first by purging with the nitrogen or boiling the water to reduce the dissolved oxygen. Container is also purged with nitrogen or argon before filling and may be topped off with gas before sealing. Glass seal ampoules provide impervious barrier for a glass transmission. and butyl rubber stock is used with a rubber stoppered product that are sensitive to oxygen. Example, purified nitrogen and argon gases are most preferred. Butyl rubber provides a better resistance to gas permeation. Next important additive used in the preparation of parenteral products are the surfactants or a solubilizing agent. These surfactants are the surface active agent that is used to disperse water insoluble drug as a colloidal dispersion. They are used for wetting and to prevent a crystal growth in suspension. They are used for solubilizing steroids and fat soluble vitamins in emulsion. They are quietly used for wetting and provide a acceptable springeability for powders. Different examples include dimethyl acetamide, ethyl alcohol, glycerin, lecithin, polysorbates, dioctyl sodium sulfosuccinate, theophylline, and so on. Moving on to the next additive used in the preparation of parenteral products are tonicity adjusting agents. Isotonic solution is needed to avoid destruction of red blood cell, irritation and tissue damage. Important for large volume parenterals, rapidly administered and extravascular injection. It mainly reduces pain on injection. Examples include glycerin, lactose, mannitol and so on. This picture indicates the effect of different solution in blood cell. If the solution is made isotonic, there will be no change in the shape and size of the red blood cell because of in and out water remains same. If the solution is made hypertonic, the size of red blood cell is decreased due to the loss of water, and if the solution is made hypotonic, there will be an increase in the addition of water due to which size of the red blood cell increases. Hence, the solution should be isotonic. So the tonicity adjusting agents are used to maintain isotonicity of the solution. Last important additive used in the preparation of parenteral products are protectants. These are the substances added to the formulation to protect against the loss of activity caused by the stress that is introduced by the manufacturing process. It also prevents the loss of active ingredient by absorption to process equipment or to primary packaging materials. They are also used in protein, liposomal formulation and vaccine preparation. Good examples are chiroprotectants and lyoprotectants that are used to inhibit the loss of integrity of active substances resulting from freezing and drying. Polyethylene glycol protects the lactate dehydrogenase and a phosphofructokinase from damage by freezing. In manufacturing, attention should be given to absorption of active entity to filters such as nylon and silicone tubing for a transfer operation. In packaging material, rubber closure and other polymeric material should be examined carefully for absorptive potential. Example, infusion equipment, in infusion therapy plastic bags, infusion sets, inland filters, those are the polymers, therefore it should be carefully examined. Another example is the human serum albumin. It is used as a protectant against the absorptive loss of protein present at a lower concentration. HSA, that is human serum albumin, present at a higher concentration than the active substances and is absorbed by coating the surface and preventing the absorption of drug. So the conclusion is, the main aim of using additives or excipients in the parenteral preparation is to increase or maintain the solubility of active ingredient by adding suitable solubilizer, to increase or maintain the stability of the product by adding a suitable buffers, antioxidants and chelating agent, to ensure safety and sterility by adding a suitable preservative, to reduce pain and irritation during injection by adding a suitable isotonic agent, and to control or extend the release of a drug by adding suitable polymers. Thank you.